Here's today's MercyOne Genesis Medical Moments.
We are continuing our conversation about colon cancer with Dr. Ryan Permumpail with MercyOne Genesis Bettendorf Gastroenterology Associates. So, Doctor, you spoke a little bit about why colonoscopies are so important. Why are they preferred over stool-based testing, though?
That's a great question. I know that stool-based tests have become very popular. They play a valuable role in that they can screen for colon cancer, but they don't allow us to prevent colon cancer. And so with colonoscopies, the precursor lesion, the polyps, can be removed and help prevent colon cancer altogether.
A lot of people are turned off by colonoscopies, though, and the process of getting screened and the prep involved, correct?
Correct, yeah. I know that it's certainly not a pleasant thing to do, but certainly very important. As far as the prep is concerned, there's newer formulations that are easier to tolerate, have a better flavor profile, but certainly don't downplay the challenge of doing it. And then for the procedure itself, we have a variety of options for sedation that can make sure that patients do not feel pain and don't remember the experience.
Okay, so there are some misconceptions with colonoscopies, obviously. Talk to us about some other misconceptions associated with colon cancer.
Yeah, so some of the things that patients often think are that when they get older, say they're 72, that they can stop screening because at this point the risk is low. Actually, the risk goes up as people get older, so it's even more important to screen. Patients are often worried about the risk of perforation and that it goes up as people get older, but the modern colonoscopes are quite safe, flexible, and the risk of that is quite low, certainly less than 1 in 1,000. So those are some of the things I think people should really be aware about.
Okay, so if someone is diagnosed with colon cancer, what types of treatments are available for them?
So in the very earliest stage, there's certain colon cancers that could be removed with the colonoscopy itself. So that's a best case scenario with screening. If it's a bit more advanced than that, then surgery can remove that small segment of the colon that's involved. And if it's further advanced, based on staging studies done by an oncologist, chemotherapy or even radiation may come into play.
Okay. How much has technology changed when it comes to helping patients here at MercyOne Genesis? A lot of things have changed over the years, I'm sure.
Absolutely.
Yes.
And so one of the things that is more advanced is larger and larger polyps can be removed with a colonoscopy that previously required surgery. Mm-hmm. So more patients can avoid surgeries, get everything done on the day of their screening itself. So there's this technique called endoscopic mucosal resection where we could lift up the polyp, resect it right there and then, and help alleviate the need for surgery altogether.
A lot of medical advances then, and we've
Absolutely.
come a long way. If someone is scared about the process of getting screened, what do you say to ease their nerves?
I think it's definitely important to at least have a conversation with their doctor so that they can understand the personal risks and benefits. I do think nowadays anesthesiologists are increasingly involved in providing sedation, so watching the heart and lungs carefully during the whole procedure. And then again, reiterate that the scopes have become more flexible, are far easier to navigate the colon, and so the risks are quite minimal at this point compared to the past.
All right, well, Doctor, it has been a pleasure to talk to you. Thank you so much for taking the time to talk to us today.
Thank you very much for having me.
This was your MercyOne Genesis Medical Moments, and for more information, go to ourquadcities.com and click on the medical tab.